Okay, so have you ever wondered what happens when an X-ray shows something, well, something that's not supposed to be there? You know, a weird spot on a bone that makes you go, hmm. Today, we are going to pull back the curtain and decode how doctors solve these bony mysteries. Let's get right into it. All right, imagine this. You're the radiologist. This image pops up on your screen. It's what they call a lucent lesion. And that's basically just a spot where the bone kind of looks like it's been eaten away. So what's the first thing that goes through your mind? What's your gut reaction? And right away, the big questions start flying. Is this something we need to worry about? Is it totally harmless? Or is it something way more serious, like, cancer or a nasty infection? How in the world do you even begin to untangle a medical mystery like this to give a patient a straight answer? Now, you'd probably think that the secret is to just have a supercomputer for a brain, right? To have every single possible diagnosis memorized from some huge textbook. But actually, that is the complete opposite of how the real experts think about this stuff. So in med school, some people are taught this absolute monster of a mnemonic, fog machines. It's supposed to be this clever way to remember a whole list of different things that can cause these spots on bones. But, just look at it. It's a mess. It's totally overwhelming. And here's the straight-up truth, and I'm quoting our source here. Quote, "The whole idea of memorizing a list of 11 or 12 barely related things is stupid." And why is it stupid? Well, because all these conditions show up in different people at different ages and in totally different places in the body. So a giant jumbled list like that, it's pretty much useless when you're on the clock. Okay, so if memorizing a giant clunky list is a terrible idea, what do the pros do instead? Let's look at how they actually tackle this problem to get to an answer, and fast. Believe it or not, it all boils down to a single, simple number: 3. Instead of juggling a dozen different possibilities, experts start with just 3 main categories. That's it. See, in the real world, these bone lesions really only come in 3 flavors. The first is it bad? Meaning, does it look aggressive, like a cancer or an infection? The second is it obviously benign? Something so harmless you might not even bother mentioning it. And the third is that kind of gray area, the hard to tell bucket that just means let's keep an eye on this. And this right here perfectly captures the mindset. The normal neuron wants to overthink it, right? To list every single possibility just to sound smart. But the lion neuron, that's the expert mind. It cuts right through all that noise. It's just, who gives a shit? It's benign. Next case. It's all about making a decisive, practical call, not showing off how much you've memorized. So, once a radiologist puts a lesion into one of those 3 buckets, how do they get to a specific diagnosis? Well, they don't just guess. They pull out their detective kit. And it's this incredibly simple but powerful 3-step framework. First, you check the patient's age. Second, you pinpoint the lesion's exact location in the bone. And third, you look for a classic look, a telltale sign. That's the whole game: age, location, appearance. And let me tell you, age is a massive filter. If the patient is under 30, your brain instantly jumps to a specific set of possibilities, like solitary bone cysts. But if they're over 40, it's a whole different story. The very first things you have to think about are metastatic cancer or myeloma. So age alone slashes the number of possibilities way, way down. Next up is location. Where exactly is this thing? Is it in the epiphysis at the very end of the bone? Well, that points to a really specific group of things, summarized by the mnemonic AIGC, so ABCs, infection, giant cell tumors, or chondroblastoma. Or maybe it's in the metaphysis, the part with the best blood supply. That makes it a hot spot for infections and cancers that have spread from somewhere else. Location is your second huge clue. All right, theory's great and all, but let's make this really sink in. Let's see how this little detective kit can crack a few classic cases in seconds. Okay, so case number 1. Clue number 1 is adolescent. That's our age filter. Clue number 2 is the classic look. They have pain at night, but aspirin makes it better, and they've got a painful curve in their spine. That specific combination of symptoms is a huge giveaway. And boom, the answer is an osteoid osteoma. Those symptoms are pretty much the textbook definition for this specific benign tumor. See, the framework, age plus the classic look, it just leads you straight to the right answer. No list of 12 needed. All right, you ready for another one? Case number 2. The patient is under 30,
Age clue, check. They break their upper arm bone, and when you look at the x-ray, you see this super specific visual. A little piece of bone has literally broken off and fallen to the bottom of a fluid-filled spot. What on earth could that be? That is a solitary bone cyst. And that little clue, the fallen fragment sign, has a special name. It's called pathognomonic. It's a fancy word, but all it really means is that if you see it, it's a 100% definitive slam dunk diagnosis. Case closed. The framework works again.
And there are just so many of these classic looks. You see a long lesion that looks like ground glass, that's screaming fibrous dysplasia. A vertebra that's gone totally flat, like a pancake, in a kid, eosinophilic granuloma. You see, experts just build up this mental library of patterns. And when you combine those with age and location, diagnosis becomes incredibly fast. So when you take a step back and look at all this, the real lesson isn't just about bones. It's really about a much deeper, more fundamental way of solving problems. Here's the most important takeaway. True expertise isn't about just cramming more and more facts into your head. It's about having a better framework for thinking. It's about having a system that helps you cut through all the random noise to find the one or two pieces of information, the signal, that actually matter. And that kind of leaves us with one last question to chew on. What are the really complex problems in your life that you're trying to solve by just memorizing more stuff, when what you really need is a better framework? What are the simple rules, your own age, location, and appearance, that could unlock the answer for you?